Know Thy Health. Today's episode, we can talk about ERDs. What are ERDs? Most people have never heard that term. If you're Catholic, you may not heard that term, but many Catholics have, especially if they're involved in healthcare. Ethical and Religious Directives for Catholic Healthcare Services is what we're talking about today. We at Presidio are a Christian, America's first pro-life Christian health insurance company built on Christian principles. And we have tapped the ERDs, or ERDs for Catholic Healthcare Services, to give us a footing as we file for a religious exemption as a health insurance company. The ERDs have been around for a long time. There's a lot of precedence in the market or in the larger healthcare systems for their for them to be upheld as part of our religious exemption. So we use them as part of our, company guidelines and our health insurance plan guidelines. And so I have Bob, one of our co-founders, here to talk about the ERDs. Bob is Catholic, has a rich history navigating the ERDs and understands them very fully. And so these were something that was new to me when I joined as a Protestant, when I joined Bob and Daniel to work here at Presidio Healthcare, and had to learn a lot about the ERDs for Catholic healthcare services. Still say I still say the wrong acronym from time to time because I forget. I'm like, what's the HCRDSs? But I'm getting better. And so, Bob, tell us a little bit about the ERDs, what they are. For those that may not know.
Absolutely. So ethical and religious directives for Catholic healthcare services. And it's kind of what the name implies if you just break down the name there. So they are directives. So they're sort of like rules for Catholic healthcare systems and healthcare providers to follow. Some of them are prohibitive. Some of them are normative, meaning here's, a norm that you should aspire to as a Catholic healthcare provider. And the reason these are, I think, important is because, anybody that holds themselves out as a Catholic in the healthcare space, ministering to people who are in a very vulnerable spot, they have a particular role as an extension and as a part of a church that's held to a high standard and that has inherent values, morals, and norms that guide all of their actions, and that the charity of Christ, and Christ is our the source and summit of our faith, should be animating everything that we do. So the United States Catholic Conference of Bishops, which is what it sounds like, it's the bishops in the United States, their sort of hierarchy, they've come together to promulgate these directives to guide all of the healthcare systems and healthcare providers who are acting in the name of the Catholic Church in the United States. So think of any, you ever heard of a health system called, St. Mary's or St. Joseph's or St. whatever, or Catholic something or another, or Ascension. These are Catholic health systems, Catholic hospitals, and they operate in a particular way that sets them apart from state-operated health systems or privately owned non-religious health systems, or even other religious health systems that aren't Catholic. And there are a couple of distinctive features that you'll notice you should notice when you walk into a Catholic hospital. Number one, there might be a chapel, right? And in the chapel, there might be a minister, a priest or deacon or a religious person. If you were to go to a board meeting of some of these Catholic hospitals, they might have religious people on the board. Religious meaning like in the formal sense of the word, meaning a religious priest or brother or a nun or a sister in a habit. So you could see, like, from the top down, there's an identity that's different within a Catholic or religious health system, and the way that these ethical and religious directives come into play in a healthcare system is that they're typically in a hospital or health system in particular incorporated into what's called the charter documents of the hospital or health system. So the charter documents are typically the documents that pursuant to which the organization is governed. So the articles of incorporation are typically publicly available, filed with the state. It's sort of like a slimmed down version, like super high level, how what the entity can and can't do. And then there's the bylaws that sort of complement the articles, but deal more with internal governance. And typically, in a Catholic healthcare system, the bylaws incorporate by reference these ethical and religious directives for Catholic healthcare services. And it says all of the services that we provide are going to be performed in conformity with the ethical and religious directives for Catholic healthcare services. And just for people who are curious or like want to learn more, it's a 30-page document. You can Google it. USCCB, which is United States Catholic Conference of Bishops, Ethical and Religious Directives for Catholic Healthcare Services. We're currently on the 6th edition at the time of the recording of this podcast. There's been rumors about a 7th edition forthcoming. And the reason they update those is not, you can imagine the principles underlying the directives never change. But healthcare and our society and culture, because these are promulgated specifically for the United States of America, are changing. So as those needs and as the dynamics within the industry change, they're continuing to apply these principles to new fact patterns, and issue new editions of the ethical and religious directives. So we can, we could dive right in and sort of walk through. I mean, it might be helpful to break down the organization of this document, what it looks like, and how it can be used. Um, the document's broken into 6 sections. I've got it in front of me right here, so I'm going to reference it. So it kind of starts at a high level with the first section addressing, it's called the social responsibility of Catholic healthcare services. And I would highlight that word social and like societal. So it's sort of at a high level, like how we should be integrated into a functioning society, and how healthcare plays a critical role there, and how we should be caring for those among us who are less fortunate. And do we have a system that does that? And how ought health systems, and Catholic health systems in particular, um, be interacting with and open to and welcoming and serving those who are less fortunate, who either because they can't pay for their services or because they've got particular chronic illnesses that are difficult to treat, or for whatever variety of reasons, or the marginalized, the stigmatized, right? Part two starts to get into the individual, but at a pastoral and spiritual level. So again, this is a distinctive mark of Catholic healthcare systems. It should be a distinctive mark of Catholic healthcare systems. And it is that Catholic, as a Catholic, we recognize that the person is made in the image and likeness of God, with a body as a body soul composite, right? So there's two critical, necessary, sort of integral parts to a human being, and they both need to be cared for. And in the healthcare system, a lot of times, of course, we focus on the bodily health, and that's not something that we can just throw away in the healthcare system. But it's also important to recognize that the patient in front of each healthcare provider has an eternal soul that needs to be cared for. So sort of addressing, and a lot of what's interesting about this part too is it actually sort of goes beyond the primary, I would say, our audience of the ethical and religious directives are, like we've said, healthcare systems, hospitals, and providers. But this part two actually gets into like the sort of system and community that we build around the hospitals and providers. Even in one section, it actually says, typically the spiritual and pastoral care are going to be provided in a parish environment. So not necessarily at the hospital or health system. And it doesn't, again, these hospitals oftentimes have chapels, and they've got spiritual, um, ministers available to minister to their patients. But recognizing like this isn't just something that happens in a vacuum at a hospital and then the patient leaves and like the duty to care is over with. It sort of extends to all these different dimensions of our public life. Part three gets right into patient provider relationships. So talking about how providers specifically providing for the bodily needs or corporal needs of their patients, what we more would traditionally think of as traditional medical care, should be interacting with their patients. And then part 4 and part 5 are the heavy hitters. So part 4 is beginning of life issues. Part 5 is end of life issues. And this is where we get into some really concrete, um, here's what you should be doing. Here's what you should not be doing. Here's what you cannot be doing, um, type of thing. Or here's what you must be doing too, type of directives. A lot of these directives are, again, some of them are normative, like you should be doing this. Some of them are more, um, like laws or rules, like thou shall not type of things. They're not actually written that way, but you could think of that. You categorize them in a couple of different ways. But this is where, and this kind of makes sense too, right? As Christians, like these are the hot button issues tend to be beginning of life issues and end of life issues, because that's where ethical decision making and issues really percolate in the healthcare system. And then the last part 6 is collaborative arrangements with other healthcare organizations and providers. And this is like what's cool about this is it gets into, like, it doesn't ignore the fact that we live in a pluralistic society with other people that we have to collaborate with that maybe don't share our values, but we can work together with for a common good and to serve our patients and the people that we serve. So how ought we to approach those relationships? When is it appropriate to enter into those relationships? Is it ever the case where we should not be engaging in some of those relationships? And we can get into all of that. So that's a lot, Cameron, and I'm happy to, we could take this wherever you want, after that. But that's sort of like an overview of what the ERDs are, how they're structured, and who they sort of apply to.
Yeah, it's great. It can be a lot. I mean, there are, in terms of the sections you outlined, I've got the file pulled up, and we'll share a link to this in the show notes. There are, I'm trying to remember here, 77 directives. Each
Biblical
section,
number, right? I mean, it's sort of
yeah, each section, good thing it's not 66. We'd prefer 77. Yeah, there's 77 directives, not that many. And I would say, Bob, I don't know, I've not done the math, but I would say like 60 of them, 70 of them, are, pretty, like you would read them and universally say like, oh, this is beautiful. Like we should have this approach. Maybe even regardless of your faith or lack of faith, right? Like, oh, this is great. Like we should care for a person this way. And then there are a handful where it's like as culture changes and technology changes, and so whether it be uh, culture changing to be more accepting of gender dysphoria or technologies around fertilization, especially fertilization outside of, the marital act. They're the natural act of creation, right? There tend to be more controversial, conversations or issues with maybe parts of the ERDs, or as Bob mentioned, we're on the 6th edition, right? So the church, being the Catholic Church, then further has to revise or expand its directives to account for how culture and how technology changes over time. So, the principles hold true on what we follow, but sometimes we have to like make changes. So I was just gonna pull up. I think it was, let's see, part 3 says, just to give some example, like an example here, the professional patient relationship, and so number 23, the 23rd directive here is the inherent dignity of the human person must be respected and protected regardless of the nature of the person's health problem or social status. The respect for human dignity extends to all persons who are served by Catholic healthcare. Uh, I You could be atheist or Muslim or what have you, and you would probably agree with that. We want to respect everyone's human dignity. So, there are several directives there that are like beautifully written, and I think are just good values to hold on to. Yeah, Bob, I don't know if I give anything to add on that, but I don't
no.
I guess
It's
I wanted to kind of get into like some of maybe the ones that maybe more apply to like what we don't cover in terms of specific services like at Presidio, but just wanted to highlight that, like, these are not like a 10 commandment type directive of like, you can't do these 10 things. They're
I would,
actually
and I
much
would
more
add too.
beautiful than that.
Yeah, yeah, it's a great observation, and I think it's kind of funny. Like we've got like it's 77 directives, like you said. I don't know, 60 of them, like a significant portion of them are just, hey, these are aspirate, these are like great things to aspire to. They're sort of normative directives, and then there are some that are like very clear. It's like black and white, like you shouldn't do this, right? And what's interesting is even in those ones that are like um, prescriptive in nature, you shouldn't do this. It's it's not like the fullness of what the church has to say and offer on the subject. These are all come from a place of like there is this richness and fullness of the church's teachings, right? And the fact that we have 77 directives, which are like bullet point and sort of systematic and just easy to reference, is sort of a function of like in some ways our own laziness and inability to synthesize the fullness of the church's teachings on any one of these topics, right? Um, so like, and I think it's just important to highlight that if you were like offended by any number of these, you could go back into the source documents and their citations throughout this. There's footnotes that are somewhat helpful and could be a good starting point for anybody who's curious on like why doesn't why is IVF prohibited? Why is contraception prohibited by the church? Well, it's not just boiled down into this. They boil it down into this single sentence so it's easier to digest. But there's a whole richness behind all of these that's important to appreciate. And it's really, I would say we have these rules to bring us into that fuller truth, and not just to be like this, like you said, like the 10 commandments, like thou shalt not, even the 10 commandments. I mean, those are something that we've got because of our own weaknesses, because we need some bumpers. It's like we're like little kids bowling, and like we need the bumpers up, because if we don't have those up, like we're going all over the place, and we just need some guidance here. One I would highlight even, Cameron, and I know it's probably not like worth a ton of time on this podcast, but like there's at least three directives. It might only be three directives that address abortion. The first one is, you can imagine, the Catholic health system should never be performing abortion. Well, that's obvious. Well, guess what the second one is? The Catholic health system ought to be ministering and with compassion to any woman who's had an abortion and is experiencing that trauma. And then the third one is basically like, here are some scenarios that can be conflated with abortion, but are not, there's permissible services that you could provide that would never be, intend to end the life of the baby, but in certain grave circumstances, if the sort of like side effect or an unintended consequence of the service, ectopic pregnancy is always given as an example for that, right? So it's just, I just love, like, people tend to focus on like the negative, like, oh, the church said you can never have an abortion, the Catholic health system, but then like there's this other side of the coin, which the church says very clearly here, that Catholic health system should be ministering to people who have experienced abortion. Now, separate question whether it's implemented well or not, right? And that's obviously going to be a hospital by hospital or system by system, um, facts and circumstances analysis.
Yeah, abortion is obviously the big one. We are America's first pro-life Christian health insurance company, and the unique thing about that as it relates to the ERDs, that I've had several conversations with folks about, is when you read these ERDs, these are for uh, you know healthcare organizations. We are the first insurance company or healthcare organization that's an insurance company to actually follow suit with these ERDs. And what's interesting is that on an alternative health insurance plan that does pay for abortions, um, a member of a plan that you're on that you pay premiums to that covers abortions can go to any hospital system that is not a Catholic hospital that follows the ERDs and receive an abortion. And kind of the unique thing about us is that we kind of flip that on its head in the sense that our network is going to allow folks to go to mostly any hospital or facility they want. It doesn't have to be a Catholic hospital, but as a healthcare organization that's an insurance company that follows the ERDs, we are not going to pay for abortions at a facility that may actually offer them. which is kind of a unique thing here. And then, for us, like, we aren't going to deny someone coverage, because they had an abortion in the past, or they performed a service, right, or they've had a service performed that does not align with the ERDs. We are to directive number 46, as Bob was mentioning. Catholic healthcare providers should be ready to offer compassionate physical, psychological, moral, and spiritual care to those who have suffered from the trauma of abortion. Kind of in that vein, right? Like, we want to help serve them and come alongside, folks as a entity that follows ERD. So yeah, the abortion ones are big, in terms of, what we're doing here and what we're not covering, as a health insurance company. But I think, just more holistically, 45, 46, and 47 in terms of the directives, are very clear, like where the church stands on abortion, and I think are well written. But you've mentioned it a couple times, so we should probably go to it. Is the IVF one? This kind of comes up a lot in different conversations, and so, would love to, I guess, get your, not just opinion, but kind of recital, I guess, of what the ERDs say about IVF. Given that Presidio is not just a health insurance company for Catholics, not just for Christians. We are a Christian health insurance company, but we understand that there are alternative views out there. But I think we want to take this time to be very clear about, how the ERDs view certain fertilization practices, and then how we will handle that as an insurance company.
Yeah, yeah, no, great. So yeah, there are a couple of directives that address directly or indirectly IVF and other means of artificial, like procreation. I don't know if that's the right word, but I would say like they hinge on two moral principles. One is that the sexual act and procreation should not be separated. That's never appropriate. What's sort of laid out in the ERDs, a little bit, but there's a rich history of. I'm looking behind me to see if I've got the. No, I can see it. I've got the theology of the body. Really expands upon this. Is the reason that's so detrimental and problematic within church theology is because we know in Genesis 1 that man was made in the image and likeness of God. And it says, in his image, he created him, man and woman, he created them. So we know from that two things. One, it means something that we were made as man and woman. And it also means that we know about the image of God from how we were made as man and woman. So anytime we start to erode that relationship between man and woman, or we start to segregate how that relationship was built to be by God, we actually start to put we start to like, develop blind spots in terms of our relationship with God and how we can come to know him, because we can come to know him through our bodies and how we were made in relation to each other. We know that from Genesis. So that's one, I think, principle that the ERDs are based upon that would prohibit IVF. And the second is sort of incidental, I would say, which is any method that is going to result in so many fertilized embryos, or fertilized eggs that result in embryos that we don't know what to do with them, or it's going to result in the destruction of these um, embryos. As Catholics, we believe that human life begins at the moment of conception. It's you've got like it's the first time you've got the DNA for a unique individual, and we know that individual is going to develop into a person. So I don't need to give a science lesson here, but there's reasons why we believe that. It's not just something that we accept from the ERDs or otherwise. It's scientifically backed too, I would argue. Um, so anytime that you've got like IVF, I think we all know, like, common procedure with IVF is to make, dozens of, it's an expensive procedure. So you're going to harvest a bunch of eggs, and you're going to try to fertilize as many of them as possible. And most families are not, and sometimes you implant, my understanding is you might implant up to a half dozen of them. And most couples who are seeking IVF are not looking to have 6 or a dozen kids. They want maybe 1, 2, 3 kids. So what do we do with all those other little babies? A lot of them are destroyed. A lot of them are cryogenically frozen, which is sort of a weird concept when you think about the souls of those babies and how that how that whole thing works. So that's sort of like a secondary effect that's also morally problematic. Why that would be prohibited.
Yeah, and there's certainly and we understand like this is a sensitive topic, right? Like technology, like when you look at technology alone, like it's an incredible thing that that like God has given humans the ability along with science, right, to like to do these types of things and create life in this way from a mom and a dad. But at the end of the day, the ERDs are very clear on this topic. And, as a health insurance company, we will not, that follows the ERDs, and based on our values, right? We won't cover IVF as a service. I, I think one of the really cool things, there's a ton. I mean, I have friends who, you know, um, have conceived or had a child, through the IVF process and have now, come to grips with like the reality of, man, I was just like, we were having issues having a kid and we were just immediately pushed to an IVF, fertility doctors like, okay, we're going to do IVF. Like it's just a natural next step. And
It's a huge
they,
industry right now. Yeah.
yeah, they went back you know, through the paper trail and been like, wow, we weren't even told there were like alternatives. We were just told that we couldn't have a kid, so this is the only option. And it's very expensive. It's a big money maker. We could do a whole episode on that. But Bob, I just wanted to like give a minute here to kind of highlight some of the like opportunities couples have that may be battling infertility, that are natural, methods that are supported by Catholic healthcare organizations or the ERDs in a sense, that those could pursue. You're pretty familiar with NAPRO technology and a few others, so just wanted
Yeah.
to give a moment to kind of give a plug for that.
Yeah. Yeah. That's absolutely. I think there might even be. I'm trying to look. Yeah. So one of the directives here, and this doesn't quite get into that, but here I'll read. It's Directive 43. Catholic healthcare institution that provides treatment for infertility should offer not only technical assistance to infertile couples, but also help the couples pursue other solutions like counseling and adoption, which of course doesn't address the underlying issue of infertility. But it's just, again, it goes back to that holistic approach that I think often gets missed in this space. But I think what you just highlighted, Cameron, is a great, and I think it's like when you pursue the natural law and truth, there are often these unpredicted outcomes that result from it. And here we've got a great example of our culture is very um, it has a problem, we expect a solution right away, right? And IVF sort of purports to give us that solution. We have a problem. We always expected to have kids, right? And we thought it was something that we were going to have when we grow up, and we built our life around this expectation, and now we're experiencing infertility, and I just want a kid, right? And IVF will sort of solve that. But what IVF often or almost always neglects is there's a reason why couples can't have kids. One in five couples in America, this might be an old stat, but 1 in 5 couples in America will experience infertility. That's a big number. And the thing that doesn't get addressed by the IVF industry is there's an underlying reason for that, whether it's a hormonal imbalance or there's cysts on the ovaries or whatever reason. Um, IVF just sort of like ignores it, sweeps the whole issue, the health issue, under the rug. Because keep in mind, like um, fertility is a symptom of homeostasis. It means your body's healthy. Okay, so infertility, like invert that. Infertility could be a symptom of a body that's out of homeostasis, which means if you think of like a physician treating their patient, the physician should be like rolling up their sleeves saying like, let's figure out what's going on here. Let's run some diagnostic panels. Let's do a blood test and figure out if you've got a hormone imbalance or like what's going on. There's something that we need to address here. Problem is the compensation is not high for that. And it's easier for physicians. It's generally easier for physicians to refer those patients out, send them to a fertility specialist. The fertility specialist puts those patients on I'm speaking a little bit in hyperbole, but like not much. If you start researching this issue, they put them on a conveyor belt system because it's super easy because you don't have to like treat your patients as unique individuals with different problems and try to craft a solution that's unique to
Yeah,
them.
and that to add to that, like that paradigm or that like that process has become the norm outside of fertility treatment, right? Specialization for physicians in general, right? Primary care has been like, or your general physician, right, has been like shrunk down to this very like microcosm of issues. And it's like anything that falls outside of that, it's like, oh, there's a specialist for that. We need to refer you there. They'll handle it, type of thing.
Sure,
And that's like
sure.
that's what like the incentive or like the patterns that have been created for physicians. And it's somewhat unfortunate because your primary care doctor knows you the best. They see you the most regularly. Like they should be able to treat you right. Or at least have a say, right? And so, yeah, I didn't want to interrupt you, but I wanted to highlight that, like, this isn't just a fertility, like, this isn't just an issue that's because of like fertility issues get handed off to a specialist. Like, this happens in every kind of vein of healthcare. Uh, but this is the one that's most relatable to the ERDs, which is what I'm talking about.
Yeah, and I think this is probably the one that's most prevalent right now. We've got a booming IVF industry right now. We've got private equity getting into the space. It's very hot space right now. And it's becoming more of a cultural issue too. You see like Trump making comments about mandating coverage for IVF. So I think it's particularly it's like it's in the cultural crosshairs right now, right? But all of this to say, like Cameron, like if you are experiencing infertility and they say go to IVF, the problem is that you're infertile and that will make you fertile. It ignores the entire underlying health condition, which the health condition isn't that you're infertile. That's the symptom. And I'm beating on a drum maybe a little bit here that's been beat on a lot, but I really think that's important because this whole industry doesn't treat the patient as a person. And again, coming back to like the crux of what Catholic healthcare is and ought to be is to treat the patient as a person, as a unique individual with inherent dignity as made in the image and likeness of God. And the way we do that in the fertility space is we say, okay, let's dial in on this. Let's figure out what's causing your infertility. NAPRO technology is a technology that was developed in part to diagnose underlying conditions that result in infertility and to treat it. There's surgical treatments that are available to a lot of conditions that couples experience that result in infertility, and they're treatable in a way that actually increases fertility. It's actually as effective or more effective than IVF in terms of couples that go in, they can't have a child, and they come out on the other end with a child, which it should be mind blowing to anybody listening because why do we have this entire system that's not even as effective as this, that doesn't even treat the underlying issue? It's you got to think there's economics at play, or there's just like a laziness of providers and not rolling up their sleeves and embarking on this journey and treating their patients with empathy, figuring out the underlying health condition. So that's, I don't know,
Right.
Cameron, that was a long-winded answer to your
And
question, but it's
the Protestant upbringing or Protestant side of me, the not Catholic side, like always wants to be like, just like, you know, one empathetic and like sensitive to folks who either went through IVF or whatnot. I would just like say like what Bob and I are trying to like highlight here with this one issue or issue that is related to the ERDs is that even if there was no immoral view on IVF in a whole, right? Like if IVF could solve the problem of, you know, no embryos are left, frozen or unused or put to waste, right? Um, the marital act piece wasn't deemed outside of the marital act piece wasn't deemed immoral, right? If you remove the immoral issues of IVF, it still is a it still is a service that's being performed without addressing like the underlying like health issue. So like even if you remove the immoral components of it, um, it's it's unfortunate that young, primarily young couples early in their career trying to start a family with not a lot of money have to pay for such an expensive service out of pocket without being even directed into other alternatives that are natural. And to Bob's point, like have a pretty good track record of helping folks kind of overcome these issues. So, we at Presidio, I just give a shameless plug for what we're doing here. Are working very hard to build partnerships with providers and organizations who make these resources and this information available to people. And so we're really excited about that to help, help folks take the next appropriate step into figuring out what might be going on. And so, that's just something I wanted to highlight there, Bob.
No, yeah, I appreciate it. And I think it's cool too, because you think of, I mean, here's another interesting fact is like majority of health insurance companies, they aren't covering IVF. But if you, Presidio member, like we want you to experience that fertility and that joy of having a child. And, if God has that in the cards for you, like we're going to push you to the services that are available to treat that. And we're going to cover those services. So it's another, it's one of the ways that we want to, build a culture of life and be truly pro-life. And I would be remiss if I didn't say, obviously, the way a child is conceived has no bearing on the dignity of that child, right? So of course
100%.
I think that's something that people struggle with is they hear that this is immoral and they think, well, gosh, I know somebody, or maybe I was conceived that way. It has no bearing. I mean, there's a whole spectrum of immoral ways children can be conceived, right? Like I don't need to go down the list. Some of them are complete atrocities, and but the child that is the fruit of that. I mean, God, that's how marvelous God is that He brings good out of these, like our absolute um perverseness. So just to like no bearing on the dignity of the child, no judgment on couples, especially those who have been duped or didn't know the options available to them. But the exciting news is like we want to bring this good news to more people, make it available to folks. And
Yeah.
I think that's like the ERDs kind of like backhandedly like bring us into that space where we're forced to come up with these more creative solutions that actually solve issues.
Yeah. Yeah. And that's the cool thing about what we're doing. Like as you said, that's in alignment with the ERDs, where you have this industry that makes a lot of money, and it can help folks have a child, uh, but it's not typically covered by health insurance. You do see it more often in the either government funded or government programs if you're an employee of the government, or you might see it with a large employer that's self-funded. They offer this as an additional benefit. But small employers, most individual health plans, some states do require it. I don't want to get into all the statistics there, but it's not typically a covered service. And so the healthcare system pushes people to IVF that's not covered by their health insurance, which we don't really see in other spaces. Typically, they push you to a service that the insurer is going to pay for. Uh, and so, at Presidio, we get to do that differently, right? So we get to cover services to help you, bring life into the world. These alternatives, I shouldn't say alternatives, but these natural services, they're alternatives to IVF, but they're natural services for, uh, you know, helping resolve, infertility issues or other health related conditions that are causing what seems to be infertility. And so, excited about being able to, yes, we won't cover IVF, but we'll cover a whole, slew of infertility treatments that are natural and help bring, life into the world. So we get really excited about that. But, not to hammer home too much on the IVF piece, but I just wanted to circle back, Bob, like on the ERDs in whole, are there any others that we wanted to like call out or any other specifics of the ERD document that we thought was relevant to highlight for folks?
In terms of what the ERDs. I think a lot. I mean, it's a lot of the hot button issues that you would expect to see, right? So for a Catholic health system, it's abortion and IVF, which we've covered. It's contraception and sterilization procedures. Um, Something that we don't talk about a ton, just because our programs are typically we're designing the programs right now for folks that are pre-Medicare, but end of life issues too. So like euthanasia, physician assisted suicide. When is it appropriate to remove ordinary means of life sustaining care, like food tubes, um, feeding tubes? But then there's a whole host of, I mean, there's a range of just, caring for the poor and the indigent and the drug addicts and, people who are ostracized for whatever reason. I don't know if there's any in particular we want to get into on this call. I think we could probably do another one just on drilling down on some of these.
Yeah, sure. I think the other one is you hit on kind of the things we don't cover that are aligned with ERDs. The other missing would be, and I think Bob, correct me if I'm wrong, but this is part of potentially the seventh edition. Would be more some more clarity around gender dysphoria.
Yeah.
I could be wrong, but maybe that's
Yeah,
one to
no.
touch
Yeah.
on.
Yeah, you're spot on. So I'm looking for the date on the sixth edition. Um, it's actually, I just have the digital copyright is 2018. Um, but we do, yeah. So there's been a doctrinal note written by the committee of the USCCB to ask to add some clarifying language into the ERDs regarding so-called gender affirming care and services that would distort the human body in a way that's not congruent with the way that a person was born, like gender transitioning services. Um, so that's in the works. I think that was, let's see, at the time of this recording, I think that was the doctrinal note was submitted, I think 2 years ago. And I candidly don't know what the update is, but I think we can expect to see an update to these ERDs, because I think everything, again, going back to the unchanging principles on which this document is founded, there's a rich tradition, again, of the importance of how we were made in the image and likeness of God as male and female. And you've seen the Catholic Church quite resolute, sometimes in spite of a lot of persecution on these issues. And I think we're going to be seeing an updated edition in the near future addressing that issue specifically.
Yeah, thanks, Bob, for giving us a good overview here and just chatting through some of the, I guess, hot button issues, but some of the beauty in these directives that we don't typically really get from an insurance company. We've had past conversations on the show about healthcare sharing ministries. They have their version of the ERDs for their own ministry called their member guidelines. Is typically what they label them as, and they lay out some of this type of framework, or some of these, probably not as in depth, but they lay out these types of things. So we haven't seen this from a health insurer, so we're kind of pioneering something here, and we're excited about it. But all in all, to look at an available product like Presidio's health plans in the market, and to be able to know exactly where we stand as a Christian company on these issues, and what we believe, and how we're going to care for our members. I think it's really neat to have the ERDs as a giving us part of that footing as our as a religious entity, a religious insurer. So we're excited about it. But just wanted to ask in closing if you had any additional thoughts or statements kind of on the ERDs in whole, and what they mean for us.
No, I think something that you just brought up, which is really interesting, is that and this throws us in contrast with um, the healthcare sharing ministries that are available out there. The ERDs kind of are calling. They have all these normative directives saying we ought to be serving everybody. We ought to be holding ourselves out to people who look and believe in things that are different than us. And that's something that we're responding to and what we're building with Presidio, the nation's first pro-life health insurance company. It's Christian. We are Catholic as a company, and we are guided by these ethical and religious directives. But anybody can join this product as long as you're okay with the products and services that we're going to not be paying for. In other words, if you're somebody who uses contraception, uh, you're free to join our plan. We're not going to pay for your contraception because we find it immoral, and and our members, many of our members are going to find it immoral, and we don't want to be using their premium dollars to pay for that. You can pay for that out of your pocket, and join the product. You don't have to be Catholic. You don't have to be Christian. You don't have, like, whatever religion you are. If you're no religion, you can join this product. And I say that, Cameron, because you mentioned that there are community guidelines for every health sharing ministry. The community guidelines typically require you to subscribe to a particular set of religious beliefs. And part of that's, that's not a knock on healthcare sharing ministries. It's a regulatory requirement for them, which I think is maybe short-sighted or unfortunate. But it doesn't allow that sort of ecumenical nature where you think of us more like a health system, a Catholic health system. You come in off the streets, for whatever reason, and get service there. And it doesn't matter what your faith background is. The Catholic in that healthcare system's name informs how they treat their patients. It's not a restrictive measure for who can join and receive services at that hospital. The other thing I would say, just in closing, is sort of the elephant in the room is the ethical and religious directives for Catholic healthcare services really pertain to services, and they're aimed at hospitals, health systems, and providers. So we're a little bit of an outsider here, but I think we are tangentially brought into this when you read this, particularly some of the sections, regarding integration of outside organizations and how we can support each other and sort of build up this community of Catholic healthcare providers. And that's where we find ourselves is we want to be an integral building block to a healthcare system that honors the dignity of every human person and takes advantage of these gifts that we have from God to honor and build his kingdom on earth through the delivery of healthcare systems and the way that families access that.
Yeah, thanks, Bob. It's beautiful. We're excited to get this rolled out. Thank you for hearing our somewhat of our opinions and our interpretations of the ERDs, how they relate to Presidio. If you have any questions or comments about the ERDs, or you have an opinion on the matter, we'd love to hear it in the comments, and maybe we can either answer those on a future show, or reach out to you directly. Again, thank you for your time and have a good one.